Dr. Yong Kim, welcome back to the program.
It's great to be with you, Christiane.
Let me ask you, because you're not just the head of the World Bank, you are also a doctor. What is your prognosis for containing this terrible outbreak?
We still haven't turned the corner, Christiane. You know, there's a lot of things that are happening. We seem to have a much better strategy now. I think we're really focused on safe burials. We're focused on finding the people who are suffering from Ebola, and we have a timeline. And the World Health Organization and the UN have been leading on getting this timeline together. And it seems like some of the habits in the country have changed. More health workers are coming in, but we still haven't turned the corner. So no prognosis yet. We're beginning to get more serious, but a lot more still needs to be done.
One of the serious things we understand is that the WHO is rushing an antibody, a serum, to the affected nations. Is that a game changer?
Well, we're not sure, and right now there are still not enough proven drugs. There's really nothing on the market that's been completely vetted, and so we're still a bit in the experimental stage. But I think the discussions that are happening right now around potential vaccine candidates and various drugs, you know, in this one as well, they give us some sense that more is being done and there are some possibilities. But still, the ground game is critical. The ground game is safe burials. The ground game is identifying all the people with Ebola, providing them treatment, and then making sure they're isolated. And right now, again, the big issue is not a miracle drug. The big issue is getting enough people, enough health workers who can make it happen.
The United States has just announced new travel rules, particularly people coming from those parts of affected West Africa into only specific airports in the U.S. Is that likely to put a stop or to contain this?
It's extremely important not to isolate these three countries. One of the things as a medical doctor, and especially for Ebola, one of the greatest tools we have is to elicit what we call a travel history. Where have you been? And if we isolate these three countries, then we're going to lose the travel history, because there's going to be such a temptation to lie about where you've been, especially if you've been in these three countries. And so we really have to keep a stance where we're in solidarity with these three countries. We're trying to help put out the epidemic. And so I think it's very important for us not to be in a situation where the overwhelming motivation is to lie about having been in Liberia, Sierra Leone, or Guinea. And that is, to me, the most important thing that we should think about when we look at the different travel rules.
You've said you must get more personnel, more medical personnel on the ground. We've seen this success in Nigeria. It has this week been declared Ebola-free. The World Health Organization says because of a world-class epidemiological detective work. So how did Nigeria do it?
Well, first of all, and I had the opportunity to sit with President Goodluck Jonathan during the UN General Assembly, and I asked him specifically how he did it. And one of the keys was he knew every detail. So there was very strong leadership from the top, which is something you always need. And then there were many people that came from the United States Centers for Disease Control, and they put together a strategy that identified every single contact of the patient who'd come across the border. So there was one patient who came across the border, 20 infections in total. But the sense that we have to bring out of there is that this was very difficult to do. More than 200 physicians, Christiane, more than 600 other health workers, they traced 900 contacts, and they did a total of almost 19,000 home visits at a cost of well over $10 million. So the lesson here is, one, it can be done, but two, if hundreds come across the border, the response is going to be very difficult. That's why it's so important to focus on stopping the epidemic at its source.
It's also, lesson number 3 is that this is a rich, enabled country, and it was able to cope with it. What we're seeing is poor, war-torn West African nations at the hot zone are unable to deal with it. You convened a meeting with the 3 most affected presidents. What did they say they need?
Well, they were very specific. First and foremost, they need health workers. They need people who can actually roll out the response. And we're beginning to get the volunteers from various places, but the volunteers are not coming in quickly enough, because they need to come in, they need to get trained, especially in the infection control procedures, and they need to move not only in the cities and in the major hospitals, the treatment units, but they've got to get out into the communities. That was the first thing. But they also said that they're having problems with food security. They were also very concerned that the economies in those countries had almost stopped. So one of the things we're doing just this week is putting together an entire package where we'll help them certainly with the immediate response, but then also to think about the long-term economic impact and try to get the economy back and up and running as soon as possible.
You must be amazingly gratified and impressed by the Cuban doctors. I mean, the Cuban president has again seen off hundreds more doctors who are going over there to the worst affected areas, and they have really been praised a lot. Cuba clearly has something to teach the world in its rapid response, doesn't it?
Well, this was a wonderful gesture, and having worked for many years in Haiti, Christiane, I've worked with Cuban doctors. And the great thing about the Cuban physicians that are sent overseas is not only are they well trained, because the medical schools and the training programs in Cuba are extremely high quality, but they have experience working in places like rural Haiti. They have experiences working in other parts of Africa. So this particular group is precisely the kind of physicians and health workers we need.
Let me ask you about the United States, where you are joining me from right now. And I want to ask you about the backlash, the hysteria. Just reading you a couple of things. The ugliness, you know, immediate suspicion of anyone who's African and vomits. One college not accepting applicants from Nigeria. A school asking a principal in Mississippi to stay home because he went to Zambia, which has recorded precisely 0 cases of Ebola. A teacher in Maine told to stay home because he went to Dallas. I mean, there is an epidemic of fear and loathing in the U.S. right now.
I can understand that people who have not been trained in infectious disease can be fearful, but I think that this is really an important moment. Right now, what the world needs is global solidarity. This is not a disease of West Africa. This is not a disease of these 3 countries. This is something that will require all of us to step up, just like the Cubans did, just like the U.S., the U.K., the France have done. All of us now need to step up and put everything on the table. In fact, what happens is every day we delay putting money on the table, getting health workers in place, the cost over time goes up, and goes up pretty dramatically. We've got to stop this now in those 3 countries. And while I understand the fear, I really want to emphasize to everyone who's listening that fear has to be translated into a greater sense of urgency to tackle the problem where it's based.
Well, as we talk about this fear, we're showing this cartoon that appeared in the Sacramento Bee, which basically puts all America's national pastimes in the framework of fear and panic. But the question, therefore, is it under control in the United States?
Well, Christiane, I'm not involved in the direct response in the United States. I'm very involved in the developing world, but not here in the United States. And let me just say this. I think there were a lot of lessons learned from the Dallas case. But I think the leadership is strong, and I think that the combined experience of the leaders in the United States will bring us to a point where we will bring the outbreaks here under control.
Dr. Yong Kim, thank you so much. President of the World Bank, joining us on this really important topic today.
Thank you, Christiane.